The images I have taken from the various sources. I do not claim that all the images included in my presentation is mine. Now, coming to the topic, I say when we talk about anatomy, I can say that anatomy is one of the oldest science dating back to the at least you can say 3000 before Christ. And the study of anatomy has been critical to understanding the life and you say disease. But it's also important, you say, to understand how new technologies can be used in a way that enhances our understanding of anatomy. The idea of translational research, if you see over here, right, is arising all over the world. And the term translational research was first used by US National Institutes of Health in 1988. And translational medicine, when you talk about, it refers to the practice of transferring discoveries from bench to bedside. And since then, when you say this translational research has become an integral part of modern medicine, you say. So when you talk about this translational research in anatomy, it is a field of study that focuses on the application of the anatomical knowledge for medical treatment, diagnosis, and the prevention. The translational research in anatomy, when we say, right, it is an important and growing field that has potential to impact, you say, a wide range of areas. And the act of, you say, the clinical consideration, or you say the health advancement and the medical, you say, services conveyance framework should be based on the evidence-based medicines. So whatever we are talking right now, right, or in the medical science, everything we are talking about the evidence-based medicine. Now, when we see over here, what is the purpose of this translational research? When we say the background I wanted to say about this topic. So we have the continuing quest, or you say the mission for safe and effective care of the global health needs, you say. And the evidence-based medicine remains the cornerstone of the clinical practice. So just now I was mentioning that how important this evidence-based medicine is that. So that's what I'm telling that this evidence-based medicine, it remains the cornerstone of clinical practice. So the main reason for researching and publishing the high quality scientific articles in the high impact journals or the index journals, you say, lies in the learning to use and critique evidence for responsible decision making. So this is all what we can say is the purpose of the research, and based on that, trying to avoid as much as possible the medical and surgical failures, whatever are there during the clinical practice. So based on this evidence-based practice, we try to avoid as much as possible this medical and the surgical failures during the practice, we say. Now, when we talk about this translation is the process of turning observations, whether it is in the laboratory or you say clinic or you say the community. So what I wanted to say that the translation is the process of turning the observations in the laboratory, in the clinic, you say, or in the community into the interventions that improve the health of individuals and the public, be it from the diagnostics and the therapeutics to the medical procedures, or not only the medical procedures, even you can say the behavioral changes. So all these, when we see this translation or the translation research, it integrates research from the basic sciences, right? Not only the basic sciences, even the, you say, the social sciences or the political sciences. So what I wanted to say that this translational research, it integrates, right, from this basic sciences, social sciences and political sciences with the aim of optimizing the patient care and preventing measures which may extend even beyond the healthcare services, we say, right? So what I wanted to say in short, that it is the process of turning appropriate biological discoveries into drugs and the medical devices that can used in the treatment of the patients. So when we talk about the history of this translational research, as I said that for the first time, this translational research word use was used by the US National Institutes of Health in 1988, but it appeared in PubMed, this translational research word, this first appeared in the PubMed in 1993. And it has become quite common, you say, since 2000, you can say, right? So it has been written repeatedly, and the translational research lacks a clear definition. And that when you ask 10 people about the definition of the translational research, you will probably get 10 different responses. Like when we were in the MBBS, we used to say that whenever you give one ECG report, right, to 10 physicians, the 10 physicians will give the findings will present in a different way. So similarly, what I wanted to say over here, that when you talk about the definition of the translational research, you ask from the 10 people, right, probably you will be getting the 10 different responses. But when we talk about this translational research in the dictionary, it has been mentioned that concerned with facilitating the practical application of scientific discoveries to the development and implementation of new ways to prevent, diagnose, and treat the disease, right? So this translational research started trending since 2020. So it's not too far. The 2 years back, you say, this translational research has started trending. Now, when we see this translational research, whatever we discussed till now, so in the simplest word, when we need to define in one sentence, we can say that the conversion of the discoveries from bench to bedside is the translational research. I said that when I entered in the medicine, or whatever the concept that I have encountered when I entered in the medicine, the translational research, what I mean is that the conversion of discoveries from bench to bedside, that can be defined, the appropriate definition in one line, you can say, of the translational research. Now, coming to the deficit, when we see the deficit in the conversion of basic sciences discoveries to the novel approaches, when we say that improve the human health, or you say that generated the concept of, or you say the emphasized upon the translational research. So at present, the definition of the translational research appears to reside in the eye of the beholder, you can say. Now, when we talk about this National Institute health programs, such as you say CTSA, that is the clinical and the translational science awards, the medical school units, and there are some new medical journals, they have all been created and are dedicated to this translational research. And in fact, you can say that this translational research may have received more attention and more resources than any other entity without exact definition in the history of the medicine. But the issue is that it addresses very serious, or you say the pressing the most worthy of the effort and attention. So whatever the attention it's getting, it is very much worth, and it deserves that. Now, what is the need of this translational research, right? When you see over here in this diagram, right, in one line, we can see the need of the translational research over here, that the translational activities serves as a bridge between this basic research over here and the applied, or you say the bedside research. So what I wanted to say over here, just one study estimated that it requires 17 years for only 14% of the new, you say the scientific discoveries to become incorporated into the standard practice. So you can understand how much time it takes while implementing the new discoveries, whatever is coming from the basic research. So effective translation, when we say of the new knowledge or the techniques which are generated by the development or the advances in the new basic research into new approaches for, you say, the prevention, or you say the diagnosis and treatment of disease, is essential for improving the health. Now, when we talk about this translational research, there are two models. One is the 2-stage model and another is the 5-stage model, right? Now, in 2-stage model, if you see over here, the T1 research refers to the bench to bedside, meaning is that the translating knowledge from the basic sciences into the development of new intervention. Whereas when we talk about the T2 research, it reflects the translating the findings from the clinical trials, whatever the clinical trials were there, into day by day practice. So, in other words, the T1 can be described as the transfer of new understanding of disease mechanisms, which were gained in the laboratory into the development of new methods. That is, you can say that the diagnosis, therapy, and the prevention, including the first testing in humans. Whereas when you talk about this T2, right, this T2 is described as the translation of results from the clinical studies into everyday clinical practice, and not only the clinical practice, even the health decision making. So this is the major difference between T1 and T2. Now, another model we will see, that is the 5-stage model. Over here, you can see these are the 5 stages model: T0, T1, T2, T3, and T4. So T0, that indicates, that includes the basic science research, whereas T1, the whatever the research was there in the basic science, the advancement, the translation to the humans, whereas in the T2, it is the translation to the patients, whereas in T3, it is translation to the practice, and in T4, it is translation to the community in the national wide, right, in a large scale, you say. So when we talk about the T0, in that we have the preclinical and the animal studies, whereas in case of the T1, we have the proof of concept, phase 1, and the clinical trials, whereas in T2, it is the phase 2 and 3 clinical trials, whereas in T3, it is phase 4 clinical trials and the clinical outcomes research, whereas in T4, if you see over here, it is the on the population level, or whatever the outcomes are there of the research, right? So when we see over here this 5-stage model, so effective translation from the clinical studies to the widespread clinical practice will achieve only the part of the goal of improved health of the entire population, if you say. Why so? Because there exists a gap, right? So there will be a gap between the clinical practice and a population-wide health, which is rarely discussed in the translational research field. So that is the major issue over here, you can see. Now we'll see this by the example. We'll take the example of the cancer, its diagnosis and the treatment, we can say over here, right? So many standard cancer treatments, if you say, like it can be treated in the various ways. We have the chemotherapy, we have the surgical treatment, we have the radiotherapy also, right? So like when we talk about the chemotherapy, it works in a generalized manner. How it works? That they kill the cancer cells by affecting the cell's ability to grow and divide, right? So the translational research, when we see over here, so this translational research can help uncover these treatments and are more targeted, and this will be more effective. So when we talk about this cancer, it is primarily a disease of genetic abnormalities. So identifying these abnormalities helps us learn more about, you say, the biology of the different cancers, and then it develop more specific ways to control, or you say to cure them. So this might start with the basic discovery of the genetic mutations, you say, for a certain cancer type, like you say, GIST, that is the gastrointestinal stromal tumors. So what happens that the translational studies used those findings to see if a targeted drug could help patients with those mutations live longer, and it worked. Means you will be surprised to know that the patients went for living an average of 1 year, you say, without the drugs, and because of this translational research, whatever the with the drugs, you say, the patient survived for 5 years. So what I wanted to say, that the patients with went from living on an average of 1 year without the drug to 5 years with the drugs. So you can see there is a transformation in the treatment and the outcome. So the lifespan, if you say without the drug, it was for 1 year, and with the drug, it came out of the approximately 5 years, right? So when we see this translational research, there is a just reverse to that. We say the reverse translational research. So what do you mean by this reverse translational research? Now, the translational research, when we say, it can also go from clinic back to the laboratory, right? That when it goes back to the laboratory from the clinical, it is called as the reverse translational research. So what I wanted to say, that the translational research can also go from a clinic back to the laboratory, and this is defined as the reverse translational research. Now, what happened when physicians noticed that a certain drug, like you say, the cancer drug, only seemed to benefit some patients, right? Now, what happened that the translational studies sought to find out why it happened that it is beneficial to particular some of the patients only. So when they worked on that, right? So working backwards, researchers identified that there are some specific mutations, right? And those specific mutations in some receptors, and patients who had those mutations had a dramatic response to the drug. So this is the reverse translational research, when we go back to the laboratory from the clinics, right? So when the consultant, the physicians, they encountered that these drugs is affecting only to a particular patient, they again they worked on that. They identified that there are some specific mutations, and accordingly the output is coming up. So this is all about the reverse translational research. Now, what are the challenges over here in the translational research? So there is a clinical research roundtable. This clinical research roundtable identified two translational blocks, you say. One is the T1 and another is the T2. So these translational blocks, which are called as T1 and T2, that existed in the, you say, the research enterprise, and could form the basis of a more detailed, you say, definition of the translational research. Now, when we talk about this T1, right, the T1 consisted of a block in the transfer of new understandings of disease mechanisms gained in the laboratory into the development of new methods for diagnosis, therapy, or you say the preventions, and their first testing in the human. Whereas when you talk about this T2, right, the T2 was described as an obstruction to the translation of results from the clinical studies into everyday clinical practice and health decision making. So these two were the challenges, that these two translational blocks are there, T1 and T2, right? So what I wanted to say, that these studies aimed at overcoming T1 and T2 blocks, right? And this would therefore constitute the translational research. So in nutshell, we can say that T1 could be viewed as a patient-oriented research, whereas T2 can be viewed as a population-based investigation. So this is the major differences, you can say, between T1 and T2. Now coming to the translational research in anatomy. Now, when we see over here in this slide, being from the preclinical subject, honestly, when we see, it is mostly restricted to the teaching, and whatever the opportunities are explored in the anatomy, it is not overwhelming. There are several reasons, there are several factors behind that, and one of the factors you can say that because of the over workload, right? Maybe due to several courses, you can say, running in the ensured with the limited number of faculty, because if you see, even the National Medical Commission has reduced the number of faculty or the strength. So a smaller be various other regions. So you can say that the research is more of an obligation for, you can say, the promotion, or you say the increment, right? So I'm not criticizing, but this is a fact. We can say that usually we do the research or we publish papers. This is just because of the obligation, you can say, for the publication. That is basically for the promotion and the increment rather than the passion. So with my experience, you can say, as with the experience whatever I had as an editor-in-chief of an Scopus Index journal, I regret to state or say that most of the research papers in India, especially in anatomy, is not focused on the translational research, right? Because there are other reasons also, because the trend, it is trending since 2020 only. So it will take time in the various institutes to work on these fields, these areas. But we have ample opportunities, right? When you see over here that we can collaborate, right? In the there is a, because of the lack of collaborations, you can say, or you can say the failing to figure out the need, what is the need of that, and the mere, you say, the addition of the facts or number to the existing database. What I wanted to say, that usually whatever we are publishing, we are just adding to the existing literature. We are not innovating something new. We are not discovering something new, whatever, because for the promotion, right, or for the increment, the publication is required. So we are just publishing, and we are adding the facts, whatever the there in the existing literature. And we are not collaborating with the other specialties or the sub-specialties or the departments, and failing to figure out why, what is the need of the translational research. So all these are the present scenario, you can say, in our country, you can say. So when we see the translational research in anatomy, we have ample opportunities or the scope, you can say. We have the genetics, we have the molecular biology, we can collaborate with the different departments, like you can say the neurology, you can collaborate with the radiotherapy, you can collaborate with the surgical disciplines. There are so many departments with that you can collaborate. So the field of genetics, if you talk about, right, this field of genetics provide ample opportunities for the translational research, right? Now, when you talk about the human genetics, this human genetics is the centerpiece of translational research, we can say. And the main goal of this is to identify the DNA sequence, or you say the copy number of alteration or the variation. And apart from that, I said the epigenomic alterations that alter risk to common human disease. So the first step requires in the field of the genetics, that is the recruitment of the human subject, followed by the molecular genetic studies, you say, or identifying this disease related genes, right? So apart from that, when we see that once the genes or the molecular mechanisms are identified, they are validated, right? Whatever the genes you identify for the particular disease or whatever the conditions are there, right? So once you identify, right, they will be validated in the research lab. Now, application of this genetic testing will provide a diagnosis for the families, and this will provide their clinicians the tool to advise families both in regards to the, you say, the prenatal diagnosis, you say, or you can say for the latest care of the individuals with the particular disease or the disorder. Apart from that, the lab findings can be translated back to the research arena, and the human cohort research, when we talk, right, when it is combined with the studies in the animal models, you say, right, and back again, it provides a complete circle, you can say, for improving the healthcare. And this branch is called as the translational genomics. So what I said, that when this human cohort research is combined with the studies in the animal models, and it goes back again to provide a complete circle for the betterment or the better healthcare or for the improvement of the healthcare, this branch, this specialty is called as the translational genomics. Now, when we see this translational genomics, right, this translational genomics, it aims to improve, you say, the human health by building on discoveries made through the genetics research, you say, and applying them in the clinical setting. So this progress had been, you say, made possible by the technological advances in genomics and analytics, you say, by the digital revolutions. There have been the revolution, and such advances enable the development of the prognostic markers, you say, the tailored interventions, and then apart from that, the design of the prophylactic preventive approaches. So this is called as the genetic counseling, you say, right? So when we have the understanding, or you say a deeper understanding of the link between this genome-wide sequence and the association with the well-characterized phenotypes, will empower the development of the various biomarkers to add to the diagnosis, and it will inform the disease progression also, and it will allow the better targeting of the, you say, the treatments to those patients who are suffering from the various genetic diseases or the carcinomas. Now, when we talk about this translational genomics, it has been divided into the various stages, like T0 to T4 stage. So over here in the slide, you can see over here, T1, T2, T3, and T4 stages are there. So currently, when we talk about, there is a great amount of the genetic discovery research occurring that includes, you say, the new genomic variants, you say the biomarkers, and other basic science discoveries are there. And that will include the, whatever the basic science discoveries are there, that will be included in the T0 stage. But when we talk about this T1, means beyond this initial or the basic science discoveries, when we talk, there are four developing phases or you say the overlapping phases, that is T1, T2, T3, and T4. Now, when we talk about the T1 research, right, this T1 research, this bridges the discovery to candidate health applications, or you say from bench to bedside. Now, in T1 research, what happens that it encompasses the development of new diagnostic tests, you say, or apart from that, the interventions in the clinical setting, but there will be a limited fashion, right? There will be a limitations. But when you talk about this T1, right, this T1 research would be like evaluating the gene environmental interactions, you say, or the evaluating the functions of the genomic variants. Whereas when you talk about this T2 research, right, this T2 research evaluates, you say, the clinical utility of the candidate or the patient, you say, regarding this genomic applications in clinical practice. Like when we talk about this, the example when we say that T2 type of research would include whether a genomic application performs better than the standard care in improving the health outcomes. So whatever the standard treatment was there, right, when we did the research, whether the outcome or whether that the healthcare is improved or not. So there will be the development in the evidence, you say. So the developing evidence from the clinical setting to identify, you say, the evidence-based guidelines that will be related to the T2 research. When we talk about the T3 research, so this T3 research, it includes that which assesses the implementation and the integration of the genomics into the routine clinical practice. What I said, that when we talk about this T3 research, it includes studies that assesses, you say, the implementation and the integration of the genomics into the routine clinical practice, as I said, in the T2. Whereas in the T3, what I said, that when you talk about the example over here in the T3, right, there will be the evaluation of implementing genomic applications in the community-based centers, right? So the scope has increased. Now, in case of the T3, it is applicable to the centers, the community-based centers. Whereas when we talk about the T4, it will be implemented in the broad area, in the national area, or you say the national program. So what I wanted to say, that when we talk about this T3 research, it includes those studies which assesses the implementation and the integration of genomic into the routine clinical practice, right, specified to the specific community center. Whereas when we talk about the T4 research, right, this T4 research will evaluate the population health, right, that will have the impact of the genomic medicine. So the example you can see, that performing the nationwide surveillance, you can say, to evaluate how the implementation of a particular genomic test has affected the population health. So this is all about the difference between T1, T2, T3, T4, right? So coming to the deficit, the opportunities when we see over here, currently, when we talk about, there is a very little genomics research which have been conducted and published in between T2, T3 or T4 research. Now, when we see over here in the slide, till now, right, 22,500 cancer-related genomic epidemiology have been published, right? Out of that, when you see over here, 344 genomic applications were proposed for cancer and preventions, you say, since 2009, only 344. This is the data we have taken from the National Institutes of Health from the US. And then out of that, the 70 evidence-based recommendations that addresses cancer-based genomic test. Out of that, only 26 these tests have been recommended for use of application in a healthcare setting. So these are the, you say, the deficit or the opportunities where you can explore, where you can grow. So there are only less than 2% of the cancer genomics, you say, right, research which have been funded by the National Cancer Institute, you say. And out of that, you say the less than 0.5% of that had been published, right, in the cancer genomic research is T2 and beyond. So that you can have the idea about that, right? Now, when we talk about that, apart from that, the implementation of genomic applications that lack an evidence base can have high costs in terms of the adverse health outcomes. And apart from that, it increases the healthcare costs as well, right? So if you can say over here, only the recent analysis in the of the National Heart, Lung, or you say the Blood Institute's genomics portfolio shows the similar trend, similar kind of trend, you can say, what we have discussed in the National Institute of the Health data. Now, this implementation of the genomic applications that lack an evidence base, you can say, can have high costs. That's what I said over here in terms of the adverse health outcomes and the increased healthcare costs. That's what we discussed right now. Now coming to the precision medicines. If we talk about that, one of the immediate clinical applications which are arising from such studies, these studies of complex disease genetics, you say, is the improved targeting of the available therapies. Now, information on the individual's genetic, if you say over here, right, that can be used to estimate their likelihood of developing disease and their likely benefit if targeted for a preventive care, or it add in the selection of the best treatment for their individual. Now coming to that, what I wanted to say over here, that the genetic studies to inform the precision medicine in the context of the best treatment include both, that is the pharmacogenomics, right, studies, that is the identification of the genetic variants that influence the drug pharmacokinetics, and apart from that, the genetic studies that strive to define disease endotypes. Means what happens that there might reflect the different underlying disease, or you say the etiologies that lie under the same diagnosis. Means whatever the patients are there being diagnosed, one of the clinical condition has been diagnosed, and apart from that, there are some other clinical conditions also with that patient is suffering. So there might reflect the different underlying disease etiologies, and that lie under the same diagnostic umbrella, you say, but with the different, you say, the optimal treatment strategies, right? So what we can do, that if there is a personalized medicine, you say, right, that is the right drug to the right patient at the right dose. So whenever there is a personalized medicine, that will be an excellent example for translating the leads from the basic science of, you say, the pharmacogenomics to, you say, to determine the right drug to the right patient at the right dose. So this is all about the particular precision medicine I was talking. Now, when we can see over here that in translational research in anatomy, we can collaborate with the different branches. That's what we mentioned over here, that we can collaborate with the cardiology, we can collaborate with the orthopedics, we can collaborate with the neurology, nephrology, pediatrics, and the various surgical specialties. So collaboration with the clinical departments will have another opportunity. And there is a need of interdisciplinary approach, and this has to be focused. And accordingly, the students, or you say the faculty should be encouraged going beyond the borders of the standard teaching program and the research, you say, and they should seek novel pathways to discover something or to innovate something new. Now, this doesn't mean that we are not doing anything new. Over here, you can see that in other branches, you say, of anatomy, I would like to quote our own work over here, right? That is, though we didn't discover this, but when we see over here in the year 2020, apart from, you say, the COVID-19, in the field of the anatomy, you say, or the radiation oncology, the discovery of the tubarial glands were one of the most discussed topics, you say, in the 2020, apart from the pandemic, or you say the COVID-19. So why this discovery is important, or the, you say, the discovery of the salivary gland? Because when you see this salivary gland, it is located in the nasopharynx, which was given much importance, and you say, when we give the radiation therapy, or in the treatment of the radiation oncology, right, it is excluded or it is masked during the radiotherapy when we treat the patients who are suffering from the oral or the oropharyngeal carcinoma. So this can prevent patients from developing xeroostomia, that is, you say, the dry mouth. So which is one of the important adverse effects of the radiotherapy to that particular region, you say, right? So we can think accordingly, and we can work and we can collaborate with the different departments. Now, again, if you see over here, this is another work which I was doing as my PhD thesis over here. You can see that is the karyoanomalic frequency assay during the radiation therapy, a promising marker in the prognosis of the oral and the oropharyngeal carcinoma. So this study was focusing on the nuclear abnormalities under the microscope, which was used to predict the prognosis of the oral and the oropharyngeal carcinoma. And apart from that, accordingly, even the line of the treatment can be changed, right? So whether the patient, or you say it is radiosensitive or it is the radio resistance, right? So accordingly, it will suggest whether the line of treatment can be changed. That is, at the 4 gray of the dose, right? The line of treatment can be modified or changed based on the whether the cells are radiosensitive or the radio resistance, right? Apart from that, another work also the same, that was the karyoanomalic frequency, and over here you can see this micronuclear frequency, or the micronuclear assay, right? This is a cytogenetic study. So this was also a prognostic marker in case of the oral and the oropharyngeal carcinoma, right? So these are the various studies. This is my studies, but there are other works of the various researchers and the scientists they have performed. So accordingly, we can think and we can work in our department or the institute with in relation to the anatomy, collaborating with the other departments, right? Apart from that, if you see over here, this is an orthopedic implant, right? This is a medical device designed to replace a bone, you say the joint, or you say the cartilage to damage or deformity whenever there is a fracture, right, in the, you say, the knee joint or the fracture of the patella, right? We need to fix this with the implant. So what I wanted to say over here, that the design and the manufacturing of the customized implants is a field that has been rapidly developing in recent years, right? And taking this into the consideration, we collaborated with the IIT Roorkee, the engineers of the IIT Roorkee, right? So they put it on their website also, that everyone will agree that the medical infrastructure of India needs to be better, and there is a need for innovation in the sector. Following the same line, Dr. Kalia is there. He is there in the orthopedics department. So we together, we developed one company. We started one startup company, that is the Veer Bhadra Implants, and it is showing a wonderful response, right? So what I wanted to say, that there is a need for thorough study of the morphology and the morphometry of the various anatomical structures to design and customize the 3D model, right? Imaging techniques are also widely used to study the morphology and the morphometry. And apart from that, the knowledge of these will be very much significant or useful in designing such implants to a particular gender, you say, or even to a particular population. So these are the various works you can see which we have done in collaboration with the other departments. Now, for uh, working on this translational research, when we are trying to explore this area, right, there are different bodies who are funding for the translational research. When you talk about the foreign bodies, or they are like, we have this National Institute of the Health, right, United States. These are following disease-oriented, you say, the drug-targeted strategies for the translational research. And the Center for Drug Evaluation and Research, they have designed of the United States, and they have demarcated, you say, the Center of Drug Evaluation and Research, the, you say, the US FDA. FDA means the Food and Drug, you say, the administration. They have established one separate cell, and that separate cell, it is called as the Office of Translational Sciences. This has been created, this cell has been created to catalyze and provide thrust to the basic researchers, right, for, you say, the technology transfer, or you say the drug regulatory review process will be there, and all other facilities to expedite this translational research. So all these, apart from that, there is a Spark program, right? This is of the British Council, Spark program. This is an initiative for the partnership between the university, right? And apart from that, the whatever the experts are there, the industry experts. So between the university, the subject experts, you say, or the industry experts, they have established to provide a cost-effective model to generate, you say, the proof of the concept using the industrial standards. So there are two types of biomedical research centers. One, we say, confined to the, you say, the comprehensive biomedical research center, and another is the specialist biomedical research centers. So these are the works which are being done in the abroad. But when we talk about the India, right, in India, we have the Department of the Biotechnology, which comes under the Ministry of Science and Technology, right, the government of India. Now, this Department of Biotechnology, they have taken an initiative in translating the identified leads to, you say, the scientific and the technological prototypes, you say, and to promote the innovations or whatever the patents are there by transforming the scientific leads for improvement in the healthcare system, you say. Now, apart from that, when you see over here, we have the Biotechnology Industry Research Assistance Council, right? This is a no-profit public sector enterprise, and they have been set up by the DBT only, that is the Department of Biotechnology, right? Ministry of Science and Technology. They have set up this, and the initiative of BIRAC is mainly focused to encourage and empower the emerging biotech industries, you say, in the Indian continent. Apart from that, if you see over here, same thing what we discussed about the Spark over here, right? In Indian research setup also, the Spark model is there, and this Spark model in India would be the most suitable model. Why so? Because this model includes more than 100 experts drawn from different scientific fields, right? And not only from the scientific fields, even from the social areas and the various industrial subject matter experts, they work together as per the project basis, right? On, you say, the project to project basis, and they focus more on the fundamental research for, you say, the drug discovery, or you say the developmental process. So what I wanted to say, that in Indian context, the Spark model is more successful because of the n number of the expertise, because of the hundreds of experts are there from the different fields. Now, when we see over here, this translational research, it has gained so much importance in these days that there are the journals on this, right? Dedicated journals, the Translational Research in Anatomy. Over here, you can see this is the journal, Translational Research in Anatomy, and he is the editor-in-chief, the, you say, the Waloka, he's from Poland, right? He is also the member of the Federative International Committee for Scientific Publication of IFA. So apart from that, there are various other journals also which are dedicated for this translational research. These are translational research in anatomy. We have the translational research, the Journal of Translational Medicine, and apart from that, we have the American Journal of the Translational Research. So there are various journals are there. If you have articles, you can send to these journals, right? And I can tell about this translational research in anatomy. The first decision will be given at the quickest time, you can say within 2-3 weeks or so, right? Now, when we talk about the future, what is the future of this, right? So when we talk about the future of the healthcare, it lies in the, you say, the continued progress of the acceleration of adopting, you say, the translational science, right? The two principal constructs are there. One is the translational research, right? And another is the translational effectiveness. And collectively, when we talk about the translational research and this translational effectiveness, collectively, when they strive towards the patient-centered, you say, the effectiveness, you say, the focused and the evidence-based care through these applications, we can say, and the methods which are used on the patients, the translational research obtains new information and it will directly benefit the patient in return. So the bench to bedside approach is specifically designed to improve the health outcomes and the standards of the clinical practice in healthcare to better serve the patients, you can say. So it is through the utilization, or you say the dissemination and implementation of the best evidence-based practice that will help in understanding of the, you say, the intervention effectiveness. So this way we can see the future of this translational research. Now, a word about this reverse translational research, that just now previously we discussed about this reverse translational research, right? So this reverse translational research, it is in contrast, you say, to the reverse translation, right? So it also includes the bedside to bench top research. Over here, you can see this is the translational research from the basic research to the clinical research, whereas in the reverse translational research, it is going from clinical research to the basic research, right? So when we talk about this reverse translation, it is also called as the bedside to benchtop research. And it begins with the actual, you say, the real life patient experiences in the clinic, or you can say during the clinical trial, and it works backward to uncover the mechanistic basis for these experiences and clinical observations. So what I wanted to say, that in the reverse translation paradigm, you say, the research becomes seamless, right, and continuous. Apart from that, you can say that it is a cyclical process in which each new patient observation stimulates the new testable hypothesis, and accordingly they can help in refining, and it leads to the next clinical trial, you can say, or for the next human experience. So this way, this reverse translational research, it promotes for the further, you say, the research activity, and it will further enhance the treatment or the healthcare of the system. Now, coming, summarizing the stock, if we say over here, the translational research, it includes two areas of translation. One is the process of applying the discoveries which were generated during the research in the laboratory. And if you see, whatever the discoveries were generated in the lab during this, you say, the research, and in the preclinical studies, trials and studies in the humans. So what I wanted to say, that we can conclude in two ways. First way, we can say that this is the process in which we can apply whatever the discoveries were there, whatever the innovations were there, whatever things have been generated during the research in the laboratory or in the preclinical departments in the studies, to the development of trials and the studies in humans. Whereas when we talk about the second process, the second area of the translation concerns, that second area, the research aimed at enhancing the adoption of the best practices in the community, right? So that will be the cost effectiveness of the prevention and the better treatment strategies is also an important part of the translational science. So this is to summarize. Now to conclude, if we say this translational research, I will say that always concentrate on the applied aspects, whether it is the area of the research of histology, the embryology, the gross anatomy, the neuroanatomy, or even in the medical education, right? Rather than just adding onto the existing literature. So we must always concentrate on the applied aspects of the anatomy. Secondly, I would conclude that currently when we see there has been revolutionary advancement in the biomedical research using, you say, the gene, or you say the cell-based therapy, that is the stem cell therapy, or you say the nanotechnology, proteomics, genomics, artificial intelligence, right? And apart from that, even the robotic technologies are there. So these are redefining the research strategy. So what I wanted to say, that there is a need to redefine the traditional research strategies from fundamental basic research to the clinical applications to lead new technologies and therapeutics. So this is all about the translational research, right? Because this is an upcoming area, and recently it is trending. So not much of the work has been done. So we have a lot of opportunities to explore on work in the translational research. So this is all about from my side. Thank you. Thank you so much.
Durga చెప్పరా దుర్గా ఓటింగ్ నీకు చెప్తాను రా, కన్ఫర్మేషన్ అయితే ఇవ్వలేను. చూస్తాను, చూసి ఫోన్ చేస్తాను నీకు డేట్ లేదు. క్లోజ్ చేసానా?
Now we welcome our next guest speaker, Dr. Sani, from the Department of Data Diagnostics, Dr. Sani is the origin of the topic anatomy of
Okay. Shall we leave, Mr. Rajesh?
Yes, sir.
Okay, thank you.